In the UK, about 70,000 people a year break their hip bone. It's the most common injury in older people requiring treatment in hospital. Older people who have broken hips experience a significant impact on their mobility, independence, and quality of life. Half of these injuries occur right next to the hip joint and are treated with a hip replacement, in which the top of the thigh bone is replaced with a metal implant. This is known as a hemiarthroplasty. Doctors have different views on how best to fix this implant to the thigh bone. Some doctors believe that using bone cement is best, whilst others feel it may be better to use specially coated implants that do not need cement. Making sure that the implant is securely attached to the bone is very important. If the implant is loose, it can cause pain and affect daily activities. To decide which method of fixing the implant in place is best, the University of Oxford coordinated a large study called the World Hip Trauma Evaluation 5. This study involved more than 1,000 people aged 60 and older who had been treated for a broken hip in hospitals around England. We used a process called randomization to split the participants into two groups with similar characteristics, such as gender and age. One group had their broken hip fixed using an implant with cement, and the other had their hip fixed with a cementless hip implant. During the first year after their operations, participants in the study were asked questions about how they were feeling and how well they were able to do day-to-day activities. The study found that those patients where the implant was secured with cement had a better quality of life and less pain during the first 4 months after their operation. During the early stages of recovery, patients who received the cemented implant also had better mobility. 12 months after the operation, there were no differences in quality of life, pain, or mobility between the groups, and an equal number of participants had died. Patients treated with a cemented implant had a shorter hospital stay, and the total cost of their treatment was less for the NHS. Overall, we recommend that hospitals use cemented implants for those patients receiving a hemiarthroplasty for a broken hip.